Hi, I'm Dr. Stephenson, and welcome to Medical Minute with Norton Healthcare. I commonly hear from patients, when should I worry about joint pain, and what are some symptoms related to joint injury? Joint pain can be caused by a variety of factors, from a simple injury to a more serious condition like arthritis. How do you know when you should be concerned? If your joint pain is severe, persistent, or comes with joint swelling, it's time to come in and see us. Pay attention to the affected joint. Is there redness, warmth, or tenderness? These are signs of inflammation and potential joint damage. Other symptoms related to joint pain and swelling include difficulty moving the affected joint, and in some cases, you might notice bruising or a deformity, indicating joint injury. If you experience joint pain that lasts for more than a few days, or if it's severe and affects your daily activities, it's time to pay attention. Persistent joint pain might indicate an underlying issue that needs medical attention. Joint issues, if left untreated, can lead to a more serious condition like arthritis or joint damage. Remember, your joints are crucial for movement and quality of life. Don't ignore persistent joint pain and swelling. Early intervention can prevent long-term joint damage and improve your overall well-being. It's important to remember that every patient and diagnosis is different. If you have questions about your specific condition, I recommend you talk to a provider about a treatment plan that is right for you. For more information or to schedule an appointment with a provider, visit nortonorthopedics.com.